Hello, welcome to the Managing Mask Mandates Masterclass. I wanted to create this training for you because with the removal of the mask mandates in Ontario and the changes around that, I am talking to a lot of folks who are having a lot of anxiety around this, some personal health triggers, some health anxiety, and some social anxiety. And so the purpose of this class is really to get to the bottom of that. And I want to start by taking a minute to think, where were you the first time you wore a mask in this pandemic? Take a minute and try and put that all together. I know it seems like a long time ago. This is me and my daughter in matching homemade masks on her first day of kindergarten. This was September in 2020. And while masks were mandated at her school and in our health region, they were not throughout the province of Ontario at that time. And I know for myself personally, we started wearing masks in certain settings before we were told this was a must do. So this workshop is for you if you are feeling confused, concerned, and you care about the fact that these mandates are changing. There's a lot of conflicting information out there. You might have some fears and concerns about getting sick 2 years into this pandemic. And I know a lot of you care deeply about both your health and the health of the people in your community. And those are the factors that we're going to take into account as we navigate today's workshop. So why are we having this conversation today? Like I said at the beginning, we are basing this conversation in the province of Ontario, where I live and work, because Ontario is changing their mask regulations. And so we are having a lifting of kids requiring to wear masks at school and businesses required to ask their patrons to wear masks inside. And there's been a lot of difference of response to that, with some businesses saying they will continue to require masks, others saying they won't. Healthcare settings like the one that I work in is still requiring masks. And so there's a lot of change happening, and that's why we're having that conversation today. The information that I'm sharing will be based in Ontario. And so if you are joining us from another jurisdiction, the concepts will be the same, but the details will be different. So you'll need to think about where you're from and which facts are more relevant to you and your choices. So I just want to take a minute to frame how we're going to chat today. The first thing we're going to talk about is understanding risk. So how can we frame our thinking around risk and risk management? Then we're going to talk about real versus imaginary fears, identifying health risks from health anxiety, and trying to walk that line in terms of what is a real concern, what do we have influence over, and then what actions do we want to take, reflecting on those things. The next piece is the numbers. When are numbers helpful, and what numbers do we have? When we're dealing with real anxieties, facts can often help illuminate things that were scary. And so I'm going to do my best to share some numbers and some context. And then we're going to talk about the benefits of making a decision in advance. I use this a lot when we talk about boundaries in my private practice and through the Tranquil Minds program. When we talk about boundaries, they are really decisions that we make in advance, and they can be really effective at reducing anxiety. So the first thing that I want to be clear on is that there are no absolutes when it comes to health risk. Everything is more or less. And this is something that we intuitively know. We know it's better for us to sleep more. We know that smoking cigarettes increases our risk of lung cancer, but we also probably, know people who have smoked and do not have lung cancer. So it's not a one for one. And that is true with everything as we move through this conversation, is that there are no guarantees. And I think we can all think of experiences in our life where the statistics did not maybe go as we were expecting in our health. And so this is neither a good thing or a bad thing. It's just a reality, and it can be helpful. I also want to frame the thinking of where the pieces of information are coming from and what their priorities are. So I want to talk about public health. And public health makes recommendations. They are not making a recommendation to you as a person. They are making a recommendation to everyone around how we can preserve the population as a whole. This is true for things like alcohol and cigarettes, and this is true for things that have come out around the pandemic. These are best practices designed without any individual in mind, and that is their goal of public health. Why is this important to mention? Because sometimes it feels like the recommendations are made directly to us. A mask mandate coming out being like, okay, I have to wear a mask for my safety, when really the recommendation was we have to wear masks for our safety. And it's a small difference, but when we get into making decisions for ourselves, it's good to put that in context. I find it helpful. The next, government. Okay. This one's a little cheeky. I put that the government's main priority is to get reelected. And I put this there very intentionally. I hummed and hawed whether I was going to be so blunt about it. But at the end of the day, the government's job is to govern in a way that the people re-elect them because they like how they have been governed. And so because of this, as we talk about changing things through the pandemic, public impression, public opinion, these things weigh on how the government releases information and what they do, because their job is to represent us in a way that most people like. And then individuals. So individuals have individual goals. Someone's main goal may be personal health. It may be the health of their community. And I really think it's important that we, especially on the issue of masks and reopening in the pandemic, that we are very clear that belonging is an important driver of all of our decisions. It's a core need. We need to belong. And unfortunately, there's a lot of data that mask wearing, more so in other countries like the United States. I don't have as much data from Canada around this, but it has become highly politicized, with folks believing that their risk of catching coronavirus or becoming very ill from coronavirus is very linked to their political beliefs, more so than their age or their personal risk factors. And that drive is really, I think, driven with that belonging piece. And so these behaviors have become deeply ingrained parts of our identity. And so that's, I think, an important thing to see for ourselves and for others as we have compassion for everyone's choices. So when we're thinking about risk, there's two categories: our personal risk factors and then risk factors that are in the community. And so in terms of our own personal risk, a major factor of getting very sick with the coronavirus is your vaccination status. So more doses of a vaccine for COVID-19 decreases your risk of hospitalization and severe disease. But that is not the only factor. Other factors are things that relate to your health status. So age, diabetes, hypertension, other heart diseases, lung conditions like asthma, depression seems to be a factor. So there's many health concerns that can play into how your body is prepared to respond should it encounter COVID-19 or the coronavirus that causes COVID, the disease we call COVID-19. So this is a factor as well that relates to someone's personal risk. There's also behavioral factors. So how many social contacts do you have? How much physical proximity are you having to people? Are you wearing a mask? Now, these factors are some examples of things that you might want to think about when you're thinking about your own personal risk, but this is not meant to be an exhaustive list. There are other factors, and if there are things that are important to you, absolutely, for your personal risk, you want to take those into consideration. Community risk. So with any disease or infection, we consider, yes, what's going on with the individual, but also what's happening in the community. So an example of that would be how prevalent something like, I'm thinking of the measles, let's say, is in your community. And so if there is an outbreak of that in the area, then public health will take actions to try and protect people against that particular disease. And so the same thing, that same model you can use to think about that we were already doing pre-pandemic with other diseases is being used to think about community risk of COVID-19. But because we are in a pandemic, the disease is everywhere. And so some of the things you can think about in terms of community risk is, one, the vaccination status of the community. So yes, we talked about like personal risk and what's going on for you, but we can also think of like, what is this population like? If your community has a higher vaccination rate, then there is it is more likely that there will be less viral loads circulating in your community. COVID-19. So the actual virus itself, we can think of case numbers in your community, positivity rate of testing of the people that are being tested. How often is it that they actually have COVID? And then also, as we've seen throughout this pandemic, the variant that is active in your community can dramatically change the risk in your community. The other thing on a community level to consider is system capacity. We often think of this in terms of beds or ventilators in an intensive care unit, but also considering staffing and other factors that go into our system to actually make it run is very important. And so if you were to become very sick, would there be a system that could support you and increase the chance of your recovering? Or anyone getting sick. And so this is another piece of the community risk factors. And again, like personal risk factors, this is not meant to be an exhaustive list that includes absolutely everything. These are just some of the pieces that are important and that are getting spoken about when we think about how are we going to think about how we're going to respond to this. So framing this conversation, real versus imaginary fears. I really want to talk about trying to identify whether what you're worried about right now is a risk and how much of that is anxiety. This is a really hard thing to do, but I want to invite you, if it's safe for you, to think about what exactly your worries are with the mask mandates being removed. And in this space of thinking, like anything might come up for you. I'll share for myself personally, when I ask myself, like, what are you actually worried about? I'm worried about schools closing. It's not, so we'll use that as the example as we move through the next steps, but yours could be anything. So evaluating the worry, likely. Is this event likely to occur? That can be really difficult to assess. But getting some idea of, okay, this is a real fear that is probably going to happen, or this is a real fear that like probably isn't going to happen, can be really helpful. In terms of my example around, I'm worried that cases will spike and that the schools will close. I mean, it's certainly possible. I don't think it's likely in the short term. Control. Is this something I have influence on or something I can control? In the case of my fears that schools are going to close, no, I have no control over that. And even the pieces I can control, like my personal mask wearing habits, are going to have no impact on whether or not this ends up happening. So there is nothing productive that I can do about this. I kind of just have to give it up. And then the last piece is peace of mind. And this is where we take these worries that we have no control over and work on finding some kind of surrender around them, or looking at what a good enough step is. If there is some factors that you have control on, like perhaps your fear is with masks coming down, you will personally contract coronavirus if you have not done that. And then, is this likely? I mean, we are in a pandemic. Everyone is likely to come into contact with the virus of the pandemic. That is the most likely outcome in a pandemic. But is this something I have any influence or control on? Sure. You can choose vaccination. You can choose behaviors. You can choose good management of pre-existing health conditions. So I agree that all those things are complicated, and some people have more access to control those pieces than others. That is completely inequitable and not fair. And these are things that it is possible for some individuals to have control over. And then peace of mind. So when that's the case, what is good enough going to look like? Because perfection is not possible. There are folks that followed every single rule, were very careful, and still encountered this virus. And so with that in mind, where's the peace of mind of I did my best, and then again letting go of that worry, because that is not going to change. Worrying about something's not going to change the outcome. So numbers, like, okay, it's all well and good that we've decided that we're going to, make our best decision and then follow through with it. But like, how can I make this decision? What facts do I need to understand what is actually likely? So this is Ontario data from October 5th, 2020, when the mask mandate was put in place, and March 14th, 2021, when I grabbed the data for this presentation. And we can see that the number of COVID cases in Ontario, we're sitting at a little over 600, and now we're at 2,000, which is around 4 per 100,000 or 15 per 100,000. There should be an extra 0 here. My apologies for that typo. Another thing that I think was worth looking at, these are just facts that I am including in my consideration. There's tons of data out there, are vaccination rates. So back in October, we did not have October of 2020, we did not have an approved COVID vaccine. We were hopeful that that would come soon. And now we're sitting at 85% of Ontarians have had access to have had at least one dose of a COVID vaccine. And then the other thing that I think is relevant is our understood method of spread, or at least the officially shared method of spread, which back in October 2020, we were told that it was droplet spread, meaning that there needed to be a liquid from a cough or a sneeze. I think we can all remember Justin Trudeau saying we need to avoid speaking moistly. That was around droplet spread. And now we know that this is an airborne disease where we do not require large droplets. And I think, for those that were paying attention, there were some hints back long before it was declared as airborne, suggesting that this was in fact how this was transmitted. But nevertheless, this was the official position in October of 2020 and then March 14th. So you can see, yes, we have more cases, but we also have more vaccination, and we have a different understanding of how this virus moves throughout the world in a way that's far more transmissible and much more difficult to control. So when we first started looking at reopening back in February 2021, there were some tiered restriction models released by the government. So everybody remember the Ontario framework? We were in lockdown and we were hoping to move towards prevent this, this green level. And back in February, our current level of infections would actually be in yellow right now. And in order to move to green, or the lowest restrictions, our weekly incidence rate would need to be fewer than 10 cases per 10,000 people, and the test positivity rate must be under 0.5%. And in this original reopening model, green levels will still require face masks and distancing in indoor settings. So we're not using that model at this time, but this is a way that we were thinking about it earlier in the pandemic. Then shortly after, May 2021, our roadmap to reopen was introduced. This was entirely based on vaccination. And so that was a model whereby once 70% of our population had one dose, like I said earlier, we're at 85% now, we could move towards being able to do all of these things. Now, as we know, many things have changed since May 2021. We had the Omicron variant, which really changed a lot of how many were hoping this sort of reopening would go. But tiered restriction models in Ontario, many things have changed, including our vaccination rate, the introduction of the Omicron variant. Another thing that's changed is how data is reported. And so I was sharing that under the original framework that had all those colors, we would be in yellow because of our test positivity rate being so high. But we've actually changed how our data is reported. We're doing much less testing. And while I know many people have been frustrated from that, from a data perspective, from a medical perspective, this happens all the time. As we learn who is most likely to have a positive test, we try and test those people. So people who are unlikely to test positive, we don't need to do the test. And so the fact that our data is higher, this was structured on purpose. And so it's just important to note. who can act assessing. And the other thing that's changed is like public cooperation and what I'm calling pandemic fatigue. People just wishing this to be over. And when we look at things like the government's role in changing these restrictions, they are looking at public health data, but they are also taking into a consideration how the public wants them to behave. The other model that is available, it's not for our country, it's based in the United States. The Center of Disease Control has put out a guide of when to wear a mask, which is, I think, useful. And we can talk about where the usefulness is and how, unfortunately, the usefulness does not translate quite as well to our population, but how we can use that to think about whether we should be wearing a mask or not. So they have said that you should be taking different steps based on your COVID-19 community level. And so if your community level is low, they're saying just get tested for symptoms and stay up to date with your vaccine. Whereas if the community is in medium risk, they're saying really talk to your healthcare provider to understand your personal risk around whether you should be wearing a mask. And then in high risk situations, they're saying everyone needs to wear a mask, and that like even more precautions might be needed for people who are at high risk of severe illnesses. So this is what the CDC is recommending as a regional based approach. And the regions are judged based on cases per 100,000 people in the past 7 days. And then also hospital admissions and percent of inpatient beds occupied by COVID-19 patients. And so we have access to this data pretty easily in Ontario. We do not have access to this data here, percent of staffed inpatient beds occupied by COVID-19 patients in Ontario, or at least I was unable to easily access that information. I'm seeing number of cases of COVID patients in ICU, but I'm not seeing that as a percentage of our total beds. And so that makes this model a little bit different. You can see that you can be in the low criteria, which we currently would be possibly in the low criteria, but that would really depend on our hospital capacity and how many new patients, like whether the virus was growing quickly or not growing very quickly in terms of new cases. So while this is a useful framework, especially for our American friends who can go on the CDC website, pump in their region and have it tell them which, whether their risk is low, medium, or high in terms of how much coronavirus is in their area, we really don't have this exact data. So this is what I was just saying. It's in another country. That country has lower vaccination rates populationally than we do. They do have higher hospital capacity per capita. However, lots of caveats on that in terms of accessibility. And this is the main piece. The data is reported differently. So that framework doesn't work, but it does work as an idea of thinking of low, medium, and high risks and how we might want to choose that. If our community is in lower risk and our risk is low, we may want to adopt some of those green behaviors. If our personal risk is high and our community risk is medium, we may want to adopt some of those like personal risk behaviors, and then like recommended mask wearing. And then if our community risk is high, even if our own personal risk is low, that is where universal mask wearing, even as it's not mandated, could still be a choice. And we could choose to wear a mask in that situation. So I just want to say that one of the things that this like models really don't account for at all is the human experience in this pandemic. And Everyone has had different experiences. People may know someone who has died of COVID-19. People know folks who have long COVID, who are still sick, even though they have potentially recovered. People watching this may have had experiences around that. And the experiences of loss in this pandemic have not been equally shared. And I think it's really important that when we move through these conversations, we acknowledge the fact that we have not all moved through the same pandemic. We do not all have access to the same experience. And this pandemic has impacted marginalized communities, including but not limited to people of color, Black, Indigenous, and disabled people very differently. And I just wanted to bring that up because there's certain things that we are not accounting for when we just look at numbers. Next, I want to talk about decision-making. What are we going to do with all this? So it is my belief that our best decisions start with love. And it is within that framing that I want to move and talk about love for ourselves, love for our community, and what we can do. So after looking at all of this data, the first step is really to make a decision. I know it's hard to weigh through. You might feel like you're not the most qualified person to make this decision. You're you. You're the only person that has your unique perspective on this world. You're really the only person qualified to navigate all the information we shared and decide what you're going to do. I'm not going to tell you what to do, and the government is no longer telling you what to do about masks. It's saying, we're not mandating this. This is now your choice. And so this is an opportunity to step in and own that choice and decide, what is this going to look like? So here are options of decisions. There are many other options of a decision. A decision might look like, I will only wear a mask when I'm required to. So if I show up at a space and they say you can't come in unless you have a mask on, I'm going to wear it, but otherwise it's not for me. I will always wear my mask when indoors with more than 10 people. There is a exposure-based mindset where it's, if there's going to be over a certain number of people, I'm going to wear my mask. This is another example. I will wear a mask if anyone asks me to. So this goes beyond maybe a requirement from a business and includes personal preferences and comfort levels in social situations. Another one that I wanted to share was the thinking of, I'm going to wear one in, public indoor spaces, whether or not they are requesting it for the next month, and then reevaluate. And I think that's a key piece there. And following your decision is the next piece. And including and following your decision is knowing when you're going to reevaluate that decision. And you may want to reevaluate that decision quite quickly, or you may not, but knowing where that's going to land for you is helpful. Knowing how your plan applies in different situations. If you've decided, I don't want to wear a mask anymore, I'm not going to put one in my bag, I'm done with this, know that there are going to be businesses that are still requiring masks. They are still allowed to do that. There are situations where the mask mandate is not being lifted, including healthcare buildings like where I work, including public transit. So, know how that's going to impact you as you move through the world. Share with your friends, family, and your contacts your plan. Know that they may have a different plan than yours. And so if you've been meeting with people typically wearing masks and your plan is to not wear a mask, it's polite to give a heads up. It creates good consent around boundaries, and let them know that that's your plan so that they can decide whether they're still comfortable with that. And the last piece is to be kind, considerate, and respectful. As we move through this, the mandate has been lifted. And so people, businesses are going to be making different choices around how to manage that. And the more we can see this as individuals have had unique experiences and are responding to their new choice in new ways and be considerate and respectful of those people, the smoother this will go. The last thing I want to say is I know this has been like a really heavy conversation. You don't have to sort through your anxiety about this or anything else on your own. If you need more support, the Tranquil Minds program is what I have designed to help my patients and the public move through their anxiety, focus on relieving symptoms, uncovering the causes of your concerns, nourishing your mind, body, and spirit, empowering your health decisions, and helping you maintain these healthy habits for the long term. There's 2 ways to engage in the Tranquil Minds program. There's a Tranquil Minds course, which is a self-study program of videos, worksheets, and modules open to anyone who's living anywhere. And then also there is an opportunity to work through the Tranquil Minds program one-on-one with me for Ontario residents. And this is naturopathic care. You get access to the course, but then we go much deeper and individualize assessments and treatment plans. And so if you're interested in either of those, I will put the links in the description below the videos, and feel free to get in touch with me to access that support. You do not need to be managing anxiety on your own. Thanks so much for joining me today. I'm wishing you the best as we navigate through this next phase of care, and I hope you have a good day.